Okay, so we took a look at Katie's shoulder on Thursday. Had a little bit of a bursitis, so the bursa in the shoulder was acutely, had some fluid in it. So bursitis is one of those things that responds really, really well to a corticosteroid injection, where we calm down the inflammation, and then patient is typically able to really get after their rehab. Okay, so this is her humerus here. Okay, that's bone. This is her supraspinatus tendon. Okay, and we got a little hint of that fluid showing up right there, that little dark spot. So that's that bursa. That shouldn't be there. Okay, so we're going to go right into that spot. Okay, a little poke. So we got our needle going in right there. And that bursa. Come off here. Okay, so a lot of times what I see is there'll be a significant shoulder injury, but also there'll be some type of guarding that's happened, or the patient's been really overusing something to not use the shoulder. So the biggest one I'll see is a supraspinatus injury, which allows us to lift our arm. The patient can't do that anymore because they're injured, and so what they start using is using their trap to lift, right? And so their trap will be really agitated. Some of their external rotators in their shoulder will be agitated. So along with the treatment, I'll then kind of release everything back up so they can really start to move well again. Okay, so needle is pretty small. You might feel a little poke. If you're feeling really sensitive, here, we'll pull it out for you guys, okay? Pretty tiny. It's long. It's long but thin.
I
know. Okay,
it's
so
very thin.
yeah, very thin. Okay, so yeah, you guys can huddle around if you want to watch closer. This we can't put on screen. Okay, but I'll usually grab because some people will be very spastic, and so their muscle will actually try to pull the needle, and so you just kind of want to make sure that it's going to stay where you want it. So poke in, and then so yep, she's going to get a little bit of spasming. You can maybe see it. I can feel it. Her trap is pretty agitated. She did her gymnastics class today. So you guys see that one kind of poking up here. Mm-hmm. But what we want to do is we're almost going to beat that muscle into relaxation.
Wow. How much do you piston normally?
I'll piston until I stop getting spasming.
Okay.
Unless it's a lot and I'm oh, they may not stop.
Yeah. Do you e-stim in prenatal as well, or just?
I'll only e-stim really the low back, or I'll only e-stim people where they're so spastic that they can't handle pistoning.
Okay.
What's e-stim?
So you're just gonna piston, and then the next few, if you're it's not fistulating anymore, then you're done?
Yep. Yeah.
Okay.
Okay, and we'll do a little in your external rotator, okay? That's usually, the trap is usually pretty spastic for people. Mm-hmm. So then we'll come in. So a lot of these external rotators will also get really tight for people. A lot of people are weak in their rhomboids, and so the external rotators are overworking because they're no longer pulling their scaps together. So now they're making a little muscle do the work of a big muscle.
You want to do a quick wipe?
Sorry, you guys can come around this way if you want. Okay, so what I'm doing basically is trying to feel where she's really stringy. So it's kind of up here, and then I know where the attachment sites go. They go deep into the shoulder there. So we'll start where she's a little more stringy.
You normally always go direct, or do you thread?
What do you mean?
Do you ever hold it and then go through, or do you usually more just do it direct?
Here I'll go direct because I have the scapula as a backbone, as a backdrop. Mm-hmm. Every spot's a little bit different depending on where you're going.
Yeah.
So once this is completed, is this, I think the relief is pretty quick for that patient?
So this you'll feel a little bit sore the day of, and the next day you'll feel like $1,000,000.
I get like immediate relief.
Do you?
Yeah.
Thanks.
When do you like to use the lidocaine with these?
I'll only use that if if someone can't move. They're in so much pain. So like I said, either someone who threw out their back or is in a car accident, and then they need a little bit of extra, like the needles won't do enough. Okay, all done.
Yay.
All right. How do you feel? Feel a little achy?
Yep.
Yeah. So every time I get it done, I'm a